Hello, my name is David Leggett. This is an open video letter addressing parliamentarians in Ottawa, the members of parliament and the senators. A number of years ago I wouldn't have been able to do this. I was way too sick. I've improved so much. I'm still bedridden, but the improvement, I've been very thankful for that. I used to be a teacher, an educator, a vice principal, a high school principal. I was very proud of my work and really enjoyed working with kids, with staff, and I can't do it anymore. We were on a camping trip in 2004 in Ontario, and I got bitten. It's hard to know when you're getting bitten by a tick because it's so small, but I was, and I did get a rash, which not everybody does, but nobody knew what to make of it. It was over a year before I was diagnosed. I had to leave work during that time to go on a leave, which became permanent. I tried to get help. Most doctors tried, some wouldn't. And eventually I was tested and diagnosed for Lyme and tick-borne infections. I've been in bed for 7 years, totally, required total care. I haven't been able to leave this bed at all for years. I have a personal support worker that looks after me. My wife and children look after me. Sometimes I feel like I'm a burden, but they tell me I'm not. It's nice to be loved. Not everybody has that support, though. There are many people across the nation who've run out of money, searching for a doctor who will dare treat them. Many have had to go to the States, and it costs an incredible amount to do that. In many ways, I've been fortunate. So here I am. I want to talk about Lyme disease in Bill C-442 that was tabled in the House of Commons in June 2012 and may be up for debate by the end of this year. It really doesn't matter what political party you represent. This is addressed to everyone because the needs of Canadians are foremost in this regard, and the health of Canadians is imperative that we address the Lyme problem. I'm not the only one. There's not even 100 of us. There's not even 1,000. There are thousands and thousands who really have a network across the country. We don't make up things in our head. I've been told that many times, as every other Limey, as we're called. I was properly diagnosed. It took a long time. During that time I suffered a lot. I had no idea what was going on. It was very, very scary. I was told I didn't have much time to live, but here I am. I did receive some help. There's not much to be had across the country. Unfortunately, whenever a doctor does try and help, they're typically investigated. They lose their license. They're shut down. It's really rather criminal. I want to see it stop. I don't know whatever happened to the Hippocratic Oath. There are some wonderful doctors out there, and I've met many. But the leadership of the medical system and even the political system just hasn't taken this seriously. So please, support the bill. Recently I received the Queen's Diamond Jubilee Medal. I'm very proud of it, but I'm also cognizant that many, many others across the country have done so much more and continue to do so much more for the cause of Lyme disease. With so many thousands affected, it's absolutely criminal that it's not being dealt with more. So here's a few reasons why I think the bill is so important to pass. First of all, there's so many like me. This isn't something that's rare. Medical politics might lead you to believe that it is, but it isn't. So many things are happening that are really causing a climate of fear. City mayors are adamantly denying that Lyme is in their city, obviously for fear of tourism or whatever. People are being told to take down warning signs of Lyme that they put in their windows, and people with Lyme are being denied even basic medical care by doctors who are scared stiff of being associated with someone with Lyme disease. I've been turned down by many, many doctors who wouldn't even care for my basic needs, no GPs. Testing is inadequate. They rely on controversial clinical diagnoses based on symptoms. So doctors see tick-borne diseases day in and day out, just aren't really given the time of day. But these are the people that need to be because they're in the front lines. They need to be consulted first. Current guidelines for Lyme disease are largely inadequate and don't reflect the real problem that we have and that many of us experience. They also ignore a lot of the current research and the views of people, doctors who do treat a lot of Lyme patients on a daily basis. We need adequate funding. This is something that's not going to go away. There's a health tsunami that's heading our way and it's already here. It needs dealing with. So where does our federal government fit in? Why should you be involved? First, the Public Health Agency of Canada has a mission, and I quote some of it, to promote and protect the health of Canadians through leadership, partnership, innovation, and action in public health. Sounds about right. The Public Health Agency of Canada also has another mandate, to prevent and control chronic diseases and injuries, to apply international research and development to Canada's public health programs, to strengthen intergovernmental collaboration on public health and facilitate national approaches to public health policy and planning. What a mouthful, but so true. Also, since provinces link their treatment guidelines explicitly to federal statements about Lyme disease, and since the National Microbiology Laboratory in Winnipeg acts as the gatekeeper for Lyme testing nationwide, the leadership needs to come from the men and women who represent us in Ottawa. This month of May 2013 is timely. It's Lyme Disease Awareness Month. MP Elizabeth May has been organizing a nationwide petition now for almost a year, mostly centered about the need for Bill C-442. We need champions to support the bill and to continue to support me and many thousands across our nation who are suffering, out of money, out of work, unproductive, and who languish without recognition and help. There is too much useless banter regarding Lyme disease. It is a complex illness. Ignorance of tick-borne Lyme disease and co-infections is costing health, quality of life, and lives. There is a lack of GP experience and knowledge, and when people get diagnosed with Lyme disease, we don't have the professionals who really understand it. We need to put all medical politics aside, please, and work together to move heaven and earth, to care for and to treat people and their families who are affected by this and are suffering beyond belief. There are far too many of us, thousands of us across the nation, and the response from those in power, the medical system, even most of our political leaders, it just hasn't been good enough. The onus should not be on Canadians to educate the medical community and to get down on our knees and beg for proper care. Please help. Don't be on the wrong side of history. The Lyme problem is expanding, and when the bubble finally bursts completely, there will be a reckoning, along with lots of questions about why so little was done earlier and why the appeals from thousands of Canadians who were suffering were not taken seriously and fell on deaf ears. We need a champion for Lyme. Our champions must be our political leaders in Parliament in Ottawa. I really don't care about what political stripe you wear. I just want to be well again, and I want to see this health tsunami averted before it is too late, and the casualties are piling up. Let's work together. Please help.